I had a bilateral mastectomy, and it was tough. Just that combined with losing your hair. I mean, I was just married. I was in the prime of my life, and having to shed everything that you think is so important. But in the end, because of the cancer, you realize that those things are the least important. I did opt for plastic surgery following my mastectomy. I had tissue expanders placed after my surgery and expanded and then replaced with permanent implants down the road. But I knew that would be something not important to other people necessarily, but just important for me to not have to worry about, is somebody looking at me different? Do I look different in certain type of clothing? I could just go on, have some normalcy, some semblance of my previous life. That chemo brain is real. I couldn't remember anything. I couldn't remember somebody's name right after I had met them. It was really kind of scary. I would stop in mid-sentence and not know what I was talking about. And I had a job that, I could, really get in a lot of trouble if I forgot these major components. And it was really scary, and you do think, it's going to last forever. It's never coming back. I cannot think clearly, and I'll never think clearly again. But there is just a huge, obvious difference from when I was in treatment to now. It does come back, and you can think again. Gosh, we were just barely married. When I was diagnosed, it was less than a year. And so we hadn't even started thinking about a family at that point. But we knew we wanted kids, and I did a lot of research before going into treatment about what chemotherapy could do. And unfortunately, the chemotherapy that I was on is not good for fertility, and I have lost my fertility. So that's really difficult. My poor husband had to go through this year of taking care of me, and then in the end, now we can't have kids. So we've kind of regrouped and looked at our options moving forward. We know that, adoption's a possibility, egg donor, that type of thing, and we'll move forward with that when the time comes. You try not to be angry about getting it because it's just life. But it's just kind of being mad. It's being mad at other people for being able to go on with their life without having all this burden on them, for being able to still live that carefree lifestyle when you know what can happen. And it's being angry at people for thinking that you should just be over it and be done and move on, and for maybe not recognizing that you do still live with a fear. And it's not just over when treatment ends. My name is Audra, and I'm a 1-year breast cancer survivor.